So community medicine, first is the first concept is the physical quality of life index, or PQLI. It scales from 0 to 100 scale. So what are the factors that comes, what are the parameters that we consider in the physical quality of life index? One is infant mortality, 2 life expectancy at age 1, 3 literacy. So its scale is from 0 to 100 scale. Next important concept is human development index, that is scale from 0 to 1. So the parameters that are considered here is longevity, that is life expectancy at birth. Second is knowledge, that is adult literacy rate. Third is income, that is GDP or per capita. So longevity, knowledge or income are considered in human development index. At the same time, physical quality of life index, in that we consider infant mortality, life expectancy at age 1 and literacy. Next is Sullivan's index, that is expectation of life free of disability. So next is Sullivan's index, that is expectation of life free of disability. Next concept is health adjusted life expectancy. This is equivalent number of years in full health that a newborn can expect to live based on the current rates of ill. So it's equivalent number of years in full health that a newborn can expect to live based on the current rates of illness. So these are the main concepts in the first section. Next important section is level of prevention. Levels of prevention. So the main concepts that are in the level of prevention is primordial prevention, primary prevention, secondary prevention and tertiary prevention. So what is primordial prevention? Primordial prevention is prevention of the risk factors. Then is next is primary prevention. Primary prevention is prevent the onset of the disease, that is at the pre-pathogenic phase. Secondary prevention is the prevent the progress of the disease, that is by means of doing screening test and early diagnosis and treatment. Next is tertiary prevention, that means reduce disabilities, that is done in the late pathogenic phase. So these are the main levels of prevention. Next concept is what is disease control, disease elimination and disease eradication. Disease control is that comes under primary prevention and secondary prevention, that is preventing the risk factors and also prevent the onset of the disease, that is disease control. Disease elimination means interruption in the transmission of disease, that is disease elimination. Disease eradication is extermination of infectious agent. It's an absolute process. It is done in polio and smallpox.